Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be the host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's show, we want to cover, what I feel to be a very interesting topic. I want to talk about this problem of osteoarthritis and rheumatoid arthritis. And I want to get this quote right that I checked out online. It said, according to the National Arthritis Foundation, 1 in 5 U.S. adults has arthritis-related joint pain, with 2/3 of those people being under the age of 65. Wow. The numbers increase with age. Once over 65, approximately 50% of adults experience joint pain associated with arthritis. And by the year 2030, an estimated 67 million Americans are expected to have arthritic joint pain.
What's surprising to me in the statistics is the people under 65 are having arthritis. Usually when Susie comes in the office and she says her medical doctor, she's 45, she has the arthritis, I always tell her, hey, that's not the cause of your pain. You're too young to be having arthritis. But evidently, people 40s and 50s, they're getting arthritis, which years ago is like an old person's disease. Like your grandfather had arthritis. You don't want young people getting arthritis.
Now, do you think, in your experience, that sometimes this problem of arthritis is kind of a
catch?
Yeah, like a catch-all for something. Like if I go into a doctor with some knee pain that maybe they can't explain, it's like, oh, you have arthritis or arthritic changes in your knee. So
I do agree. It's a cop-out answer, but it doesn't tell you what's behind it. Like, for instance, rheumatoid arthritis, in our experience, Jerry, a lot of people out there don't know this, it's from food allergies, environmental allergies, and lack of essential nutrients. It's an autoimmune disease. So if you give them the nutrients and you take pressure off the immune system through allergy elimination, which we do, this enables the body to heal itself because the body evidently is attacking itself, okay? So it's a cause and effect thing. So they're just telling you the fact, they're not telling you the cause. The cause is you have something wrong with the immune system, you're not getting the essential nutrients, which is 90 nutrients every day at the cellular level, and also food allergies and environmental allergies, which we also can help. So if you give them the nutrition, do allergy elimination, you can tremendously help rheumatoid arthritis, and you wouldn't need to take cortisone shots.
Right.
Okay?
Now, I've noticed also, a lot of the topics that we talk about, nutrition has a major impact on it, yet 95% of the medical profession out there, if not higher, never addresses nutrition.
If you talk to a medical doctor who graduated from medical school, he'll tell you that he gets about 20 seconds of nutrition in 4 years. 20 seconds.
Yeah.
So you can't learn anything in 20 seconds. I've been studying for years, Jerry, and I'm still learning.
Right.
And it's changing continuously. It's new information, new research. Okay, about 10 years ago, there wasn't a lot of research on nutrition.
Right.
Now, there's tremendous amount of research on nutrition. I don't know if you've been hearing, even in the media, they're talking about how essential nutrients, goji berries, superfood. I mean, this is on the internet, this is on the news, and people are waking up. I think the people are waking up even more than their own medical doctor, and they're not talking to the medical doctor about it because the medical doctor, it's not that he's stupid, he's just ignorant, he just doesn't know.
Yeah, I think the most healthy people out there are the ones that are willing to say, okay, let's look into some things. There's a lot of different aspects of my life that are impacting these problems. It's not like we talk about all the time, it's not this kind of one cause type approach. It could be a combination of, several things.
Getting back to the osteoarthritis in the knees and the shoulders, the elbows, and the spine, the best thing for arthritis, in my opinion, is the chiropractic adjustment. Because let's say you need a front alignment in your car, your tires are going to wear. The tires are your knees. So I line up your hips, pelvis, low back. That helps, the kinetic chain going into the knees. We also can adjust the knees, the shoulders. I've noticed that I've been using this new equipment. It's called Impulse Instrument. It gets tremendous results for the knees and the shoulders. What it's doing, Jerry, it's stimulating the mechanoreceptors in the joint. And what this does, it modulates your pain. Also, we're taking pressure off the nervous system. Why? Because we're setting the joint into motion. We're lining it up. It's sort of like a car. Like I said, we're giving you a frontal alignment.
Yeah.
Okay?
And that's, one of the things that in my experience with coming to a chiropractor that I think is kind of unique to people that are used to the medical profession is that if I come in for a knee problem, you're really looking at the overall body approach to that knee problem.
Right.
Unlike, if you go into a medical doctor, unfortunately, I say I got knee pain, the whole visit is focused right here on my knee.
That's usually a cortisone shot.
Right. They never really look at, even down to, how is your walking pattern? What are your, what does your feet look like? What do your hips look like? There's none of that. And that's what I really hope everybody gets from this, is that the uniqueness of your approach is what they really need to get an understanding of.
So we look at it as like the tip of the iceberg, the symptom versus the iceberg. The Titanic just saw the tip of the iceberg. We look at the whole iceberg, which is the problem. So you're having the pain in the knee. What's your real problem? What's really causing it? Is it coming from the kinetic chain? Is it coming from your ankles? Is it coming from lack of essential nutrients? Do you need an adjustment in your hips, your low back, and your pelvis? Do you need an adjustment of the knee? 9 times out of 10, a medical doctor's not going to adjust the knee. Why? They're just not trained for it. They're trained in giving a cortisone shot.
Yeah.
So it's like one cause, one cure versus our approach is many causes, many cures.
Yeah, I just, and I hope, people that, we've been doing this now for a while. We've got a lot of great information out there for people. And I really hope they're picking up on some of the kind of the building blocks of a lot of these problems. When you look at the functionality of your spine, you look at the nutrition that you're taking, because unfortunately a lot of people from a nutrition standpoint, one, they don't understand nutrition, don't know what's important. We live a fast-paced life, so we don't really focus on, and really good nutrition would be the difference in your car of going with an 87 grade gas versus a 93.
High octane.
Right, a lot of your high-end cars that are very efficient are saying, listen, you need to use that 93 octane gas, not the 87, makes a big difference. And that's what nutrition's, is a lot alike.
See, it's like the 4 sides of the pyramid. There's your diet, there's your lifestyle, are you smoking, drinking, taking drugs, are you exercising? Are you taking nutritional supplements? My opinion, Jerry, you almost have to take nutritional supplements because in the last 25 years, we've lost 50% of our antioxidants. That means, let's say you take a piece of chicken on a bagel, you're not getting antioxidants. You're not getting the phytonutrients, okay? So my advice is eat a tossed salad. Put some olive oil on that. You get the essential fatty acids. You're getting your phytonutrients, okay? So if you have a good diet and you're still not getting the nutrients, you need 90 nutrients every day, you have to supplement, okay? And then number 4 is your structure. Your brain and your spinal cord controls every cell, organ, and muscle in your body, including your knees, including your shoulders. So we're getting to the underlying root cause of the problem, and we're fixing and we're correcting. We're not just treating you, Jerry. What we're doing, you've been to a chiropractor yourself. The difference what he did is he didn't just treat you, Jerry. He fixed you, corrected you.
Yeah. Yeah, it was a totally unique approach. And once people really understand the concept and start to see, and a lot of the results are relatively quick.
Right.
When you really, get down and get these adjustments and kind of do the preventative program, one, your energy's up, your pain's down, you feel better. Life is just you're not walking through life like a zombie like so many of these people we see.
Well, if you give the body what it needs, the body heals itself. The body, we believe and we know, has an innate intelligence, okay? So life heals, okay? The body heals itself. What a concept. It's like if you take a piece of furniture and you scratch it, the furniture can't heal, but if you scratch your body heals. So therefore, if your body can heal a scratch, in theory, if you give the body what it needs and those 4 things, in my opinion, you're going to live a long, healthy, wonderful life.
Yeah.
That's how I see it.
Well, I hope everybody watching this episode today really got, there's so many great tidbits of information that were in these last few minutes, and I hope you really take some time to understand those. And most importantly, if you're dealing with, arthritis and you've got a problem, whether it's just kind of like that little achiness you're having now, or if it's full-blown arthritis, you owe it to yourself to pick up the phone, call Wellness Associates, come down and meet with Dr. Goldberg. I can't stress enough, one of the greatest and priceless things of this whole thing is that he offers a free new patient evaluation. Allows you the opportunity to come down, ask questions, meet the staff, see the environment, see what he can do for you, and discuss all of these aspects of your life, which is vital to your overall health. So, if you're dealing with this type of problem or really any type of problem, pick up the phone, call Wellness Associates, come on down, meet everybody, and see firsthand what chiropractic care can do for you. I think you'll be amazed at the results that you'll see and the impact that it will have on your health. So with that, thank you very much for watching our show today. We got some great episodes again coming up this month, so we encourage you to check back to our Wellness TV often and kind of just get up to speed on everything that Dr. Goldberg brings to the table and the education that he's offering for you on this channel. So thank you very much for watching, and we look forward to seeing you on the next episode.